So, little update on my cancer and my experience with shared decision making, as they call it. Brief review. 2 years ago, I was diagnosed with bladder cancer. It was a tumor. Doc had put a scope up into my bladder and showed me the tumor. I could see it on the screen next to me. And then in June of 24, he took it out, took the bladder, the tumor out, cleaned around the area. A couple months or so later, redid what they call a resection, did it again. And then there was some treatment, infusion treatment after that. So then I go every 3 months for a scope up into my bladder. And in December, this last December, the doc said, there's a suspicious area here. It's kind of, see that red area? And he showed it to me on the screen. And I said, yeah, he said, I don't have microscopic eyes. I can't tell whether it's cancer or something else. And so he gave me 3 choices. He said, well, we could do nothing now and then do the scope again in 3 months. We could do surgery biopsy, which is still invasive surgery. And then the last option was to go ahead and do the full surgery, take it out, and they always would add, of course, we have a possibility of puncturing your bladder if we did that, and we can fix it. But so I left there saying, oh, let's do the whole surgery and take it out of there. And then a couple days later, I got to think, I don't want to do that. And so I called him back and said, no, let's just do the scope in 3 months. So that's what we did. Came back in 3 months, and the doc said it's still there and it's getting bigger, and I'm concerned. And then he basically gave me 2 options, the biopsy or the full surgery. And I chose to do the biopsy, which is done under general anesthesia. And fortunately, the report came back that there's no cancer. There is an infection in there, so there's antibiotics I'm taking and a change in my diet to try to clear up that infection, but no cancer. The experience of shared decision making, which docs talk about, involving the patient deciding what the patient's values are. And for me to do that full surgery involves a catheter at home, maybe 1 or 2 weeks after the surgery, a lot of pain. That was something I'd rather not do. I will do it if the cancer comes back. But anyway, we got the good report. No cancer, infection, but it was a process of shared decision making, and I'm thank God that we did it.